we will be talking about a very important topic, smoking cessation. My name is Matt. As it is well documented, smoking tobacco products has a long list of negatives associated with this addictive habit. With the number of tobacco and nicotine users on the rise, a number of companies and foundations are trying to find solutions to get people to quit smoking. Quitting has enormous benefits. Some of these benefits take just minutes or hours, and some take months or even years. For example, according to the CDC, in as little as 20 minutes after the last cigarette is smoked, the heart rate drops and returns to normal. Blood pressure begins to drop and circulation may start to improve. Just one day after quitting smoking, the risk of heart attack begins to decrease. 9 months after quitting, the lungs have significantly healed themselves. The delicate hair-like structures inside the lungs, known as the cilia, have recovered from the toll the cigarette smoke has taken on them. After 20 years, the risk of death from smoking-related causes, including both lung disease and cancer, drops to the level of a person who has never smoked in their life. Also, the risk of developing pancreatic cancer has reduced to that of someone who has never smoked. Clearly, all signs point to kicking the habit. Tobacco use is the leading cause of preventable disease, disability, and death in the United States. Nearly 40 million U.S. adults still smoke cigarettes, and about 4.7 million middle and high school students use at least one tobacco product, including e-cigarettes, every day. About 2,000 U.S. youth younger than 18 years old smoke their first cigarette. Each year, nearly 500,000 Americans die prematurely of smoking or exposure to secondhand smoke. Another 16 million live with a serious illness caused by smoking. Each year, the United States spends nearly $170 billion on medical care to treat smoking-related diseases in adults. In 2016, tobacco companies spent $9.5 billion marketing cigarettes and smokeless tobacco in the United States. This amount translates to about $26 million each day, or more than $1 million per hour. Smoking-related illness in the United States costs more than $300 billion each year, and of that $300 billion, nearly $170 billion was for direct medical care for adults. With more doctor's visits means more time missed from work due to various illnesses. It is estimated by the CDC that more than $156 billion were lost in productivity, including $5.6 billion in lost productivity due to secondhand smoke exposure. With all of these staggering numbers, increasing the price of tobacco products is the single most effective way to reduce consumption. A 10% increase in the price has been estimated to reduce the overall cigarette consumption by 3 to 5%. Research on cigarette consumption suggests that both youth and young adults are 2 to 3 times more likely to respond to increases in the price of cigarettes than adults. Despite increasing the price of tobacco products, use among U.S. youth is increasing. More than 1 in 4 high school students and about 1 in 14 middle school students in 2018 had used a tobacco product in the past 30 days. This was a considerable increase from 2017, which was driven by the increase in e-cigarette use. E-cigarette use increased from 11.7% to 20.8% among high school students. In the United States, tobacco smoke is a key factor for the development and progression of COPD. Smoking leads to disease and disability and harms nearly every organ of the body. The heart, lungs, skin, bones, kidneys, and liver, just to name a few. Smoking causes cancer, heart disease, stroke, lung disease, diabetes, COPD, which includes emphysema and chronic bronchitis. Smoking increases the risk for tuberculosis, certain eye diseases, and problems of the immune system, including rheumatoid arthritis. It is estimated that more than 16 million Americans are living with a disease caused by smoking. Smokers are not the only individuals that are affected by smoking. Secondhand smoke is just as dangerous as directly smoking a cigarette. Secondhand smoke exposure contributes to approximately 41,000 deaths among non-smoking adults and 4,000 deaths in infants each year. Secondhand smoke causes stroke, lung cancer, and coronary heart disease in adults. Children who are exposed to secondhand smoke are at an increased risk for sudden infant death syndrome, acute respiratory infections, middle ear disease, more severe asthma, respiratory symptoms, and slowed lung growth. And now we will discuss why people smoke, as well as the risks and diseases associated with smoking.
Thank you, Matt, for that introduction. Hi, my name is A, and I'm here to talk about the risks and diseases that are closely associated with cigarette smoking. But before I talk about the risks and diseases caused by cigarette smoking, I want to briefly mention some of the important facts that I believe everyone in this class should know about. According to the FDA, every time you smoke a cigarette, toxic gases pass into your lungs, then into your bloodstream where they spread to every organ in your body. A cigarette is made using the tobacco leaf, which contains nicotine and a variety of other compounds. As the tobacco and compounds burn, they release thousands of dangerous chemicals, including 70 known to cause cancer. Cigarette smoke contains poisonous gases such as carbon monoxide, nitrogen oxide, as well as trace amounts of cancer-causing radioactive particles. All forms of tobacco are dangerous, including cigars, pipes, and smokeless tobacco such as chewing tobacco and snuff. Nicotine is an addictive chemical in tobacco, and after you inhale the smoke, nicotine flows through the bloodstream to your brain where it induces a pleasurable feeling. When you repeatedly expose your brain to nicotine, it becomes desensitized, making you crave more and more nicotine just to feel normal. Cigarette smoking among U.S. adults has fallen to the lowest rate in generations. According to the Centers for Disease Control and Prevention, that's good news, considering that smoking still accounts for about 480,000 deaths annually in the United States, along with an estimated $300 billion in healthcare costs and lost productivity. But the CDC numbers also offer an interesting glimpse at the 17% of adults who continue to light up still. People in the Midwest, for instance, smoke more on average than Americans elsewhere in the country. People on Medicaid are more than twice as likely to smoke as those on Medicare. Adults with a GED certificate smoke 8 times the rate of those with graduate degrees. Asians smoke less than other ethnic groups. Men smoke more than women, but not by much. According to the CDC's data, this is the current landscape of smoking in the United States. Half a century ago, more than 2 of every 5 adults were smokers, but that has fallen steadily over time. From 2005 to 2014, the adult smoking rate declined from 20.9% to 16.8%. Public officials are hoping to drive that rate below 12% by 2020. Cigarette smoking has fallen sharply among 18 to 28-year-olds. In fact, the percentage of smokers in that age group dropped by nearly a third over the past decade. CDC data show this age group has the sharpest decline for any group, but that striking change might be due to the growing popularity of e-cigarettes, hookahs, and other non-cigarette tobacco products. People with lower levels of education tend to smoke at higher rates. New data also show that smoking among people with graduate and undergraduate degrees has fallen more sharply over the past decade than among most of the other groups. Smoking among multiracial people and those classified as American Indian or Alaska natives far outpaces that of other ethnic groups. Asians continue to have the lowest rate of smokers, and along with Hispanics, have cut their smoking rates steeply over the past decade. CDC officials said the disparities across ethnic groups, which are considered with the previous research, might partly be due to cultural differences related to the acceptability of tobacco use. Midwesterners still smoke at higher rates than anyone else in the country. This was true a decade ago. But data show that while other regions have cut smoking rates by 20% or more, since 2005, the Midwest dropped only 14.4%. U.S. adults who are uninsured or on Medicaid smoke at rates more than double that of people who have Medicare or private insurance. There could be many factors at play here, but healthcare officials said one contributing factor is likely the variations in tobacco cessation treatment coverage and access to evidence-based cessation treatments across different insurance types. The number of heavy smokers seems to be declining. Between 2005 and 2014, the number of daily smokers dropped from 36.4 million to 30.7 million. Those daily smokers also reported smoking fewer cigarettes over time, from an average of 16.7 a day in 2005 to 13.8 a day in 2014. The number of people smoking more than 30 cigarettes a day fell by almost half. Cigarette smoking harms nearly every organ of the body, causes many diseases, and reduces the health of smokers in general. Cigarette smoking is the leading preventable cause of death in the United States. Cigarette smoking causes more than 480,000 deaths each year. This is nearly 1 in 5 deaths. Smoking causes more deaths each year than the following causes combined, like the HIV, illegal drug use, alcohol use, motor vehicle injuries, firearm-related incidents. And more than 10 times as many U.S. citizens have died prematurely from cigarette smoking than have died in all of the wars fought by the United States. Smoking causes about 29% of all lung cancer deaths. More women die from lung cancer each year than from breast cancer. Smoking causes about 21% of all deaths from COPD, and that cigarette smoking increases risk of death from all causes in men and women. The risk of dying from cigarette smoking has increased over the last 50 years in the U.S. Smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer. And these are the estimates. It shows smoking increases the risk for coronary heart disease by 2 to 4 times. Smoking increases the risk for stroke by 2 to 4 times. Smoking also increases risk of men developing lung cancer by 25 times and increases risk of women developing lung cancer by 25.7 times. Smoking can cause lung disease by damaging your airways and the small air sacs, called the alveoli found in your lungs. The lung diseases caused by smoking include COPD, emphysema, and chronic bronchitis. And if you have asthma, tobacco smoke can trigger an attack or make an attack worse. Smokers are 12 to 13 times more likely to die from COPD than non-smokers. Well, smoking causes diminished overall health, which also causes an increased missed work days, increased health care, and cost. So quitting smoking lowers your risk for smoking-related diseases and can add years to your life. So now that you know the facts about health risks from smoking cigarettes, maybe it's time to consider kicking the addictive habit. I'll give you Dina to talk about the benefits of calling it quits. Thank you.
Hi, my name is Dina, and I'm going to talk to you about treatment and prevention of smoking. According to the CDC, among all current adult cigarette smokers, nearly 7 out of 10, that is 68%, stated that they wanted to completely quit. To quit cold turkey with no help is most often just an attempt. Nicotine is a highly addictive drug, and quitting can be extremely difficult due to withdrawal symptoms, such as feeling irritable, trouble thinking due to strong cravings of nicotine, or feeling hungrier than usual. Nicotine dependence often requires repeated treatments, and the great news is that there are many helpful resources available that aid in the cessation of nicotine use that will help guide a smoker through the treatment process of quitting and aim towards a much healthier lifestyle and longevity. There's self-help. There are many types of self-help interventions available to smokers, such as pamphlets, booklets, mailings, manuals, videos, referrals to programs, reactive telephone hotlines and helplines, but they have not been found to be very effective. The quit rate for that is about 9 to 12%. Counseling and behavioral therapies result in higher quit rates as they provide smokers with practical counseling such as problem-solving skills, also providing support and encouragement as part of the treatment. Telephone quit lines, which may include callback counseling and proactive interventions by quit line counselors, are the most common form of counseling. The 1-800-QUIT-NOW is a free national counseling service that any smoker can call. The quit rate with that is about 13 to 17%. Bupropion SR, sold under the name of Zyban, was the first non-nicotine medication approved by the FDA, shown to be effective for smoking cessation. It acts on chemicals in the brain that are related to nicotine craving. It can be used alone or together with nicotine replacement. It is contraindicated in patients with a seizure disorder, a current or prior diagnosis of bulimia or anorexia nervosa, and use of monoamine oxidase inhibitor. Zyban can be used in combination with nicotine replacement therapies. It is available only with a prescription, and the quit rate is 24%. Then you have your nicotine replacement therapy. It delivers nicotine with the intent to replace, at least partially, the nicotine obtained from cigarettes and to reduce the severity of nicotine withdrawal symptoms. Different forms are available and may also be used in combination with the prescribed non-nicotine medication Zyban, but should not be used by pregnant women who try to quit. There are 4 nicotine replacement therapies available on the market, and all are proven to be effective smoking cessation treatments that are encouraged to use. First, I would say the nicotine gum. When chewed, it delivers nicotine to the blood and then to the brain in just minutes. Highly dependent smokers should use 4 milligrams instead of 2 milligrams, and long-term use, which is more than 14 weeks, increases the likelihood of quitting. It is available only over the counter. Then you have your nicotine inhaler. It is a thin plastic tube with nicotine cartridge inside. When you puff on the inhaler, the cartridge releases a nicotine vapor. It's like smoking a cigarette. In terms of the behavior, the inhaler is the closest thing to smoking a cigarette, which some smokers find helpful. It is only available by prescription. The quit rate with that is about 25%. Then you have your nicotine lozenge. The lozenge is a tablet that dissolves in the mouth and releases nicotine. It is available only over the counter. Quit rate is about 24%. You have nicotine nasal spray, which delivers nicotine to the bloodstream as it quickly absorbed through the nose. It is available only by prescription, and the quit rate with that is about 27%. Then there's the nicotine patch. It attaches to the skin like a Band-Aid, and it delivers nicotine through the skin. The nicotine dose is gradually decreased by switching to lower nicotine dose patches over the course of a few weeks. Use of a high dose, which would be greater than 25 milligrams, patch increases likelihood of quitting. Patches are available both with and without prescription. The quit rate with the patches is about 23 to 27%. Then you have your Variclean. It's sold under the name of Chantix. It is a non-nicotine medication that was approved by the FDA for the treatment of tobacco dependence. Its mechanism of action is presumed to be due to the partial nicotine receptor agonist and antagonist effects. It is well tolerated in most patients, though the FDA added warnings regarding the use of Chantix. It is noted the most common side effects reported among Chantix users include nausea, sleep disturbance, constipation, gas, and vomiting. Now, the least common side effects can be depressed mood, agitation, change in behavior, and suicide ideation. And suicide have been reported in patients attempting to quit smoking while using Chantix. The FDA does recommend that those who use Chantix tell their healthcare provider about any history of psychiatric illness or those noticing changes in behavior that are not typical and should stop taking Chantix right away. Chantix is not recommended for use in combination with nicotine replacement therapy. It is available only with a prescription. The quit rate with Chantix is about 33%. Then you have your medication combination. Evidence exists that combining the long-term nicotine patch with either nicotine gum or nasal spray, the nicotine patch with the nicotine inhaler, or the nicotine patch with Zyban increases long-term quit rates. Then you have counseling and medication combinations. These two combined has proven most effective for smoking cessation than either of the two alone. There is a strong relation between the number of sessions of counseling when it is combined with medication and the likelihood of successful smoking cessation. The quit rate is 26 to 32%. Now, according to the CDC, use of tobacco products in any form is unsafe. Whether it's smoked, smokeless, or electronic, the medical consequences of tobacco use, including secondhand exposure, make tobacco control and smoking prevention crucial parts of any public health strategy. States and communities have made efforts to reduce initiation of smoking, decrease exposure to smoke, and increase cessation. Some of the most effective measures that can help reduce smoking rates include high taxation rates, making tobacco products less affordable by raising taxes on tobacco products. The 2009 federal cigarette tax increase was associated with a substantial reduction in smoking among youth and young adults. The impact of the tax increase varied across male, female, white, and black subpopulations. Then there's labeling disincentives. Using explicit photos and smoking-associated health warnings on all tobacco products, packages, and labeling can make a difference. Pictorial health warnings that elicit strong emotional reactions are significantly more effective among youth and may help to prevent smoking initiation, as text-only warnings appear to have little impact. Prominent health warnings on the face of packages can increase health knowledge and perceptions of risk and promote smoking cessation. Then you have restriction on marketing and sales. By banning point-of-sale displays, advertising to minors, and the sponsorship of public events by tobacco companies. Then you have mandating smoke-free spaces. By implementing smoking bans in public places such as schools, child care centers, workplaces, hospitals, restaurants, hotels, and parks, as well as in public transportation and cars transporting minors, have been implemented in a variety of settings. These mandates have the potential to influence social norms and the smoking behavior of these populations they affect. So to help prevent smoking initiation, healthcare providers should ask children, youth, and families about tobacco use and exposure and provide age-appropriate information and counseling to prevent initiation as part of routine healthcare. They should also stay up to date on pharmaceutical cessation interventions for teens and adults and prescribe effective medications in combination with counseling. Schools and communities should legislate bans on smoking for all school and public properties and enforce such laws among school personnel and public sector workers. Educate students and families on the negative health consequences of tobacco use as part of elementary and high school curriculum and offer regular programs to screen and counsel for smoking cessation. All levels of government should continue to adopt and enforce laws and regulations that limit tobacco access for minors, including e-cigarettes and alternative tobacco products, and legislate a universal ban on smoking in cars where youth younger than 18 years of age are passengers. They should continue to regulate tobacco advertising and packaging and to specifically control newer tobacco products aimed at minors. Implement strict penalties for any establishment or individual selling contraband cigarettes. They should provide confidential access to and coverage for smoking cessation therapies, including medications under health plans. The government should also fund and encourage research on the effects of tobacco use in youth and into smoking prevention and cessation interventions that work. Smoking cessation lowers your risk for smoking-related diseases and can add years to your life. The health benefits continue to grow the longer you stay quit. Your heart, your lungs, and even your finances will see an improvement.